Good morning, everybody. This is Dr. Sonia McGowan with the Covenant Pediatric Wellness Center. We're just a little bit early, so I'm going to give people time to kind of get in and get settled, and then we'll get started here in just a few seconds. So for those of you already on with us, you are free to ask questions at any time. Go ahead and put those questions over in the Q&A box, and I will answer them as I am able to. So do not be shy. Go ahead and put any question in the box that you might have, because what I really want is for this to be able to meet the needs that you have, answer the questions that you have. So, all right, come on in, everybody, get settled, and we are going to get started with our monthly webinar talking about PANS and PANDAS. All right, so it is 9 o'clock. Let's get rolling. All right, so today we are talking about understanding PANS and PANDAS. This is applicable for parents of kids who maybe you suspect or who you know may have PANS and PANDAS. Also helpful for other doctors who might be seeing kids like this in their clinics. So my practice is sort of newly coined. We're changing our branding a little bit. And calling ourselves the Covenant Pediatric Wellness Center now. We have lots of different programs to help you. So we have our Complex Kids program, which is functional nutrition, neurodevelopmental exams, neurologically focused chiropractic, craniosacral. So we really focus on kids with complex needs. That could be kids with autism, ADD, ADHD. It could be kids with dyslexia, auditory processing disorder, any kind of behavior, language, or socialization problem. And what we really try to do is work to find the root cause of the problem. So if they're having a behavior problem, sleep issues, constipation, we don't Band-Aid that. We do labs, we do exams that help us figure out exactly what's causing those problems and correct that. We also have Covenant Pediatrics. So on my staff, I have a medical doctor, a DO pediatrician. She is a holistic pediatrician with experience in autism, PANS PANDAS, and standard pediatrics as well. We also have the Spot for Tots, which offers comprehensive evaluation and intervention for oral restrictions. We use chiropractic, craniosacral therapy, myofunctional and feeding therapies. And then we also offer prenatal and pediatric chiropractic, craniosacral, lactation consultation, and feeding therapy. So as you can tell, we are very focused on kids with complex needs. All right, so today we are really going to dive into PANS and PANDAS, helping you understand what those acronyms mean, what the symptoms are. We're going to talk about how many kids have it, when they tend to get that diagnosis. We're going to really talk a lot about potential causes or triggers. I'm going to give you some clues as to some lab tests that are helpful to help us figure this out. We're going to talk about interventions, so sort of the traditional interventions, the holistic ones, and then what you can expect. You know, is your kid going to get better from this, or is this something that you're going to be struggling with forever? So let's talk about the acronyms. So the acronym PANS stands for Pediatric Acute Onset Neuropsychiatric Syndrome. PANDAS is the same, except it's associated with strep. Sometimes you will hear it referred to as basal ganglia encephalitis, and sometimes you'll hear it called childhood post-infectious encephalitis. It's all the same. Okay, we're talking about the same situation. All right, so let's talk about how it all fits together. So see PANS as the umbrella term, okay, and everything falls under that. So when a child has PANS, there can be an infectious trigger or a metabolic trigger. So if we kind of stick to that infectious trigger side, if it is caused by strep, we call it PANDAS. If it's caused by a different infectious trigger, so a different bacteria, a virus, etc., then we call it PANS. Okay, so pandas is strep, PANS is everything else. If we go back up and we kind of jump over and look at metabolic triggers, so we can be looking at things like anesthesia. We can be talking about things like mold toxicity, chemicals, trauma, things like that. And in that case, we also call it PANS. And so what I like to do when I'm working with a family of a child with PANS or PANDAS, if it's a PANS diagnosis, I will generally refer to it as the child has PANS with a mycotoxin trigger, so that we know exactly what we're dealing with, for example. And don't forget, if you have questions, just pop over to the chat box and put them in the Q&A section for me, and I'll answer those as I can. So let's talk about symptoms. So PANS is a neuroinflammatory autoimmune encephalitis. Encephalitis basically means swelling in the brain. This can have multiple triggers like we just talked about, infectious or metabolic. So a diagnostic workup or a referral, if you're a doc and you don't do those sorts of workups in your office, so a workup or a referral should be considered in any child with a new onset of symptoms or in children with multiple current diagnoses. So if this is a child who presents in my office and they literally have 6 or 8 diagnoses, I'm immediately going to start thinking about PANS and PANDAS, and we're going to start that workup, because often what we find is kids who have autism, ADD, ODD, a whole long laundry list of diagnoses. We usually end up finding PANS or PANDAS. All right, so let's jump into the symptoms. So we will look for an abrupt onset of obsessive thoughts and or compulsive behaviors. These are many of the things that I see in practice with kids. It's very common to see hoarding behavior. So kids who will hoard particularly paper and cardboard seems to be a theme. But I've also seen kids who will hoard things like food, plastic bottles, things like that. Checking, always making sure, the stove is off, the iron's unplugged, the faucets are off. A real desire for symmetry and really being sort of compulsive about that. Everything has to be just right. Everything has to be symmetrical. Counting is another thing. So I've had kids who, one kid comes to mind who had a specific bedtime routine, and, parents had to repeat when he would count, the teddy bears on his bed, for example. And if it didn't happen in just a certain way, he was unable to move on through his bedtime routine. We see a lot of apologizing or confessing, along with some religious compulsions or intrusive thoughts around religion. So I've had patients who will say to their moms, I'm the worst sinner ever. I'm the worst kid in our family, or repetitively confessing that they, thought an ugly thought about another person. We also see a lot of fears in general, just sort of compulsive phobias, fears that they obsess on. So particularly we see fears around contamination and germs. So kids who are nervous that their food is contaminated, they don't like to, have other people or other things touch their bodies or their clothing. Some kids will, change their clothes multiple times a day if the clothing is touched by someone else or by another object. We see a lot of rituals around things like turning lights on and off a certain way, having their bedtime routine needing to be just a certain way. We have to put, this kind of lotion on our feet before we can, get in bed and read these exact 3 books, and, a whole ritual that can become really exhausting for the people or in the family. Of course, hand washing. Sometimes we'll see aggressive or self-injurious behaviors or rituals, and then sometimes some ritualized eating behavior. So we've had kids who, would only eat 1 or 2 foods at all. We've had kids who would only eat foods of a certain color, or they would refuse to eat foods of another color. We've had kids who could only eat half of what they were given, no matter how much or how little it was. So lots of rituals around eating. All right, and we see, so again, the abrupt onset of restrictive eating. Let me just check one thing real quick. Yep, okay, I was afraid we skipped a slide, but we didn't. So an abrupt onset of restrictive eating. So we'll see this in about 20% of kids. Honestly, clinically, what I see is probably a little bit more than that. Sometimes we'll see an observable weight loss, very frequent to see dehydration. And this restrictive eating for many kids tends to be sort of focused around some fears of choking when they eat, fear that the food will make them vomit. They are afraid that the food is somehow contaminated or poisoned. Sometimes it's a sensory amplification. So they're suddenly very exquisitely sensitive to taste, smells, textures, things like that. Sometimes it's related to body image or weight concern, but that's not generally what I see. Generally, I see it's more around, a sensory issue or a phobia, kind of a fear issue. Anxiety is a big one. So we see this abrupt onset of anxiety. It can be anxiety in social situations, and or it's really common to see separation anxiety. So, we'll see a child who, in their past life was, pretty independent, pretty bold and confident. And suddenly they have a lot of separation anxiety. They become really clingy with mom or dad or siblings, and just experience a lot of anxiety around being away from those important people. We see emotional lability. So up and down emotions, right? You never know who you're going to get. Lots of irritability, sometimes aggression, an increase in defiant behavior. And it's really common to see a behavioral regression. So we will see things like a new onset of baby talk, a loss of social skills or play skills. Suddenly kids, might be 8 or 10 years old, and then suddenly they revert back to wanting to watch, the cartoons that they watched when they were toddlers, or play with toys they played with when they were much younger. And sometimes we'll even see an inability suddenly to sleep by themselves. So they'll always need to sleep with parents or siblings. We also, in terms of symptoms, we'll see an academic regression in many kids. So particularly, we see a loss of handwriting skills. We see a loss of math skills. We will also see what appears to be an onset of sort of ADD or ADHD type symptoms. So they lose some of those executive functioning skills, those abilities to, prioritize and plan ahead and, just think about the big picture around, their schoolwork and their extracurricular activities, et cetera. Again, with the irrational fears. So, sometimes it's, the irrational fears around the food contamination or the food poisoning, but sometimes it's, it's other things too. Like, for example, I recently saw a little boy who developed just this out of the blue fear about fish, just certain types of fish. But he was, very, very afraid of fish. There was in my exam room was a toy that was a fish on a stick, and you can pull a trigger and it makes his mouth open. And he was very afraid of that fish toy. So also vocal or motor tics. So maybe they repeat a sound or a word over and over. Motor tics could be things like a sniff or a throat clearing, a shrug, an eye blinking, a grimace. So anything that's repetitive that appears to be out of their control is a very common thing for us to see. And then again, that sensory amplification. So, kids will suddenly, be unable to sit at the dinner table and eat their meal with their family because they can't stand the sound of other people chewing. Or, they can't stand the way their blankets on their bed feel on their skin. So, we see this kind of general everything is amplified, everything is more intense in terms of sensory input. A real hallmark of PANS and PANDAS is a change in urine habits. So these are kids who were previously dry at night, and now they're suddenly bedwetting. Or they're kids who were potty trained, and all of a sudden they're having urine accidents at school or at preschool or daycare. Maybe suddenly they're having BM accidents in their pants. We will also see urinary urgency. So all of a sudden, they just can't make it to the bathroom. A lot increased frequency or increased volume. Those things are really, really common. We see sleep disturbances. So kids who, really have a lot of trouble settling down for bed. It can be for a variety of reasons, sort of that are related to the things we've already talked about. Sometimes it's this bedtime ritual that just goes on, and they just can't settle down. Sometimes it's the anxiety. It's really common for kids with PANS and PANDAS to show anxiety at bedtime. So instead of sort of winding down, like, your natural rhythm of your day, when it gets late at night, we start to wind down, get ready to go to sleep. These kids will do the opposite. So they'll get hyper or they'll get anxious and really have a very hard time transitioning to bed. Sometimes it's nightmares, bad dreams. Sometimes it's sleepwalking. But these are kids who were once, for the most part, really good sleepers, and now they are not. Sometimes we'll see changes in gait or other physical changes. So suddenly they walk differently than they did before. It's really common when I'm doing an exam with a kid to see very, very dilated pupils and pupils that aren't super reactive to light. It's also very common to see deep tendon reflexes that are inconsistent. So maybe they're very brisk in their arms, but kind of sluggish in their legs, for example. So seeing those inconsistencies in some of those nervous system signs is really common. The other thing that we almost always see in kids with PANS and PANDAS is a relapsing and remitting course. So it means they get better and then they get worse, and they get better and they get worse. And we call those flares in my office. So flares can be for a variety of reasons. Really common cause of flares are dental issues. So when a kid gets a loose tooth, a tooth falls out, a new tooth comes in, they get braces, they get a palate expander. All of these things are very well known to kind of poke the bear and cause flares. Any sort of immune system challenge, things like that, will definitely, for many kids, bring on a flare. So here's an example of handwriting changes in kids. So here on the left, this is from the PANDAS Network, an example on their website. So you can see here, very nice handwriting in this child, but during a flare, they sort of lose those skills. This is actually a patient of mine, and you can see here, might be a little small, but he literally has very beautiful handwriting. When he is in a flare, you can see that his actual penmanship is still nice, but what happens is he is compelled to write every verb he can think of. And he will fill the page, and then he'll write on top of that, and fill the page, and then write on top of that. So there's a lot of compulsiveness around the handwriting. So PANS and PANDAS is very commonly missed by traditional medical providers. What research tells us is that over half of kids with PANS will be misdiagnosed and mistreated for over a year. And a year in the life of a child is a really long time, especially when they're having PANS and PANDAS symptoms. It's important to understand that the majority of new strep infections in these kids often cause no symptoms. And so while they were immunologically significant, the child showed no sore throat, no swollen tonsils, no fever, no rash, no bellyache. And so when a child has no symptoms, parents don't know that they need treatment, right? And so they end up having an infection with no clinical symptoms, and so then no treatment. And it allows that strep bacteria to just cook and create havoc in the body. So it's a commonly misdiagnosed situation. Often kids are misdiagnosed as having a psychiatric illness. Well, I can tell you, most of these kids have a very acute onset, meaning it's sudden. Kids don't develop a mental illness overnight, right? So a mental illness should be off the table in an acute onset. Many times these kids are misdiagnosed as having a tic disorder or Tourette syndrome. Sometimes it's OCD, sometimes it's behavioral problems. Very frequently, I hear other professionals say, it's the parents' fault because they are bad at parenting. That's nonsense, right? People they don't know what they don't know. And unless a medical professional takes a real interest in learning more about PANS and PANDAS, all of these diagnoses could make sense, right? In a person who just doesn't know any better, because for many kids, they have tics, right? So a tic disorder looks like it fits. For many kids, their presentation can look psychiatric. It isn't, but it can look that way. So, you can understand why sometimes they are misdiagnosed. So what causes PANS and PANDAS? So both PANS and PANDAS are clinical diagnoses, meaning we look at a combination of history, physical exam, and labs. Most of the cases are PANDAS, and of course then caused by strep. So about 81% of cases are caused by strep and then are called PANDAS. So patients who have OCD, who have Tourette's or some other tic disorder, are more likely than controls to have had a prior strep infection in the 3 months prior to onset. So if any child, whether you're a parent or a professional, if they have a sudden onset of tics or compulsions or obsessions, and you always have to ask, did they have a strep infection prior? Now, many times parents will tell me no, that they did not have a strep infection, but when we look at strep antibodies via blood, they are through the roof. And so that was a subclinical infection that parents didn't even know the child had. We also know that there's a higher risk among those with multiple strep infections within the prior 12 months. So we always have to ask about strep history. Cases with multiple prior strep infections have been found to have more frequent relapses. So the more chronic or the more severe the child's strep history, the tougher it is to kind of pull them out of that. And often they'll have more of that remitting, relapsing course. We can get them better. It's just, you just have to know that the longer the history, the more involved it's going to be. And again, patients often have a history of a recent strep infection that doesn't present as a sore throat. So other causes, right? So we talked about PANDAS. Let's talk about PANS. The second most common cause of PANS is mycoplasma. So this is a bacteria that can generally cause pneumonia, but in our kids, it doesn't tend to do that. It tends to just create an immune system upregulation. So mycoplasma, second most common cause of PANS. Viruses. So these are the ones that I see in my clinic most often, and they're the ones that I tend to test for, again, based on the history. So influenza, Epstein-Barr, HHV6, HSV1 and 2, and Coxsackie viruses are very common causes of PANS. Also, cytomegalovirus, parvo, and COVID are viruses that are very common triggers. And the CMV, the HHV6, the HSV, the Epstein-Barr, these are all really common viruses that most of us are exposed to. It's just a matter of whether the child can manage that viral infection and put it to bed, right? If the child doesn't have the immune system wherewithal to be able to tolerate and do what's appropriate with their immune system, then those viruses tend to just cook and create havoc. Other causes of PANS include mycotoxins. So these are kids who have been exposed to some sort of mold. Very, very common to see this. Yeah, Sometimes it's from, a water damaged building. Maybe there was, a flood in the home, or maybe, their school or therapy center has mold. Sometimes it's a prenatal exposure. Maybe mom had a mold exposure and passed those mycotoxins on to the baby. Yeast, intestinal yeast is a common cause, as are parasites and tick-borne illnesses like Lyme. So let's talk about what triggers a flare. I sort of mentioned some of the dental issues a little bit earlier, but let's talk some more about it. So what will trigger a flare? So an exposure to a pathogen will do that. So anything that stresses the immune system. So if the child is, in class and they're, the neighbor in the seat next to them has strep and they don't know it and they're at school, or maybe they're ill with a virus, anything that stresses the immune system can cause the child to flare. Also, environmental allergies, sinusitis, if a child gets a vaccination, these are all things that will stress the immune system and can potentially cause a flare. Some metabolic stressors will also cause flares. So things like trauma, undergoing anesthesia, any sort of just high stress, high demand sort of situation. Again, the mold exposure, pesticide exposure is a big one as well. So again, it just depends on, the child's constitution and any sort of vulnerability that they may have to these particular types of metabolic stressors. So again, I mentioned this earlier, but anything dental. So a loose tooth, a new tooth erupting, getting braces, getting a palate expander, having a vigorous cleaning, even a dental injury, like, a fall and maybe they hit their mouth or hit a tooth on something. So anything dental can definitely cause a flare in pandas and PANS. So what makes kids vulnerable? It's important to know this so that you can have successful long-term intervention. One of the things I say to myself a lot, and I say to my staff as well, is that for multiple things in life, you have to begin with the end in mind. And what we want is a healthy, happy child who has recovered from PANS and PANDAS. And to get there, we have to really understand what got them there in the first place. What happened, what made them vulnerable to an infection or a metabolic stressor. So again, we have to know what made them vulnerable so that we can successfully resolve this situation. So what makes them vulnerable? Nutrient deficiencies, very common. So one of the tests I do looks at a whole nutrition panel. So it tells us about any kind of deficiency in terms of B vitamins, fatty acids, vitamin D, cholesterol, anemia, anything like that will make a child vulnerable. What often goes hand in hand with deficiencies is mitochondrial dysfunction. I did a webinar a couple of months ago about that. So if you need a refresher, go back and watch that. But this is your body's ability to make energy inside the cell. So if you think about it like gas in a car, right? If you can't make gas for your car, you can't go very far. And so it's very, very common for complex kids to not be great at making gas for their car. And that certainly will make them vulnerable because you can't have a very well-functioning immune system if you aren't making energy. So that will definitely put kids in a vulnerable situation. Intestinal dysbiosis makes a child vulnerable. So any sort of malabsorption that's caused by yeast, by bacteria, will definitely challenge the immune system and make a child vulnerable. And then, any sort of nervous system dysregulation, and signs of that, are things like constipation, chronic poor sleep. So anything that shows me that a child is not moving easily from rest and digest to fight or flight and back again, any sort of dysregulation in that process will make a child vulnerable to an illness. All right, so how many kids have PANS and PANDAS? According to the PANDAS Network, they're saying at least 1 in 200. Yeah, for sure. I would say probably more. The problem is that most traditional medical providers don't really realize what they're looking at. Again, if they've not taken a special interest in this, they're not going to know. And so the average age of diagnosis is anywhere between 4 and 13. I've had kids younger, I've had kids older than that in my clinic. It's important to realize sometimes people think you have to have an autism diagnosis to have a PANS or PANDAS diagnosis. Not true. You can be just a neurotypical kid and end up with PANS or PANDAS. All right, so let's talk about how we figure this out. So we have to do a thorough history, particularly around exposures to contagious illness. We have to do a thorough family history, particularly around strep and autoimmune conditions, because 64% of kids with PANS PANDAS have a first-degree relative with an autoimmune diagnosis. So this family history of autoimmunity really makes them vulnerable to PANS and PANDAS, which is also an autoimmune condition. And then, of course, we have to do a thorough physical exam. So I look at kids head to toe. I look at their reflexes. I look at their pupillary response. I look in their mouth. I look on their fingernails, right? So I look at their skin. And so just a really thorough physical exam is definitely required. We have to look at the throat, of course, right? Because we know that strep is the most common cause of PANS. And so we always have to look. So strep infection is often found without a sore throat, yet it can generate the strep antibodies in the blood. So it's important to consider rapid strep testing. So just, the little tickle of the throat with a swab. If we're suspicious that strep is really what's happening, it's important to send out cultures as well. So throat culture, sometimes we need a nasal culture or a rectal culture to confirm what we're seeing. And then labs are a very important part of this. So I like to do general labs. So I like to look at things like a CBC and a CMP. I like to look at their cholesterol levels. I like to look at their vitamin D levels. But then I also sort of drill down and do specific labs that get to the suspected pathogen or toxin. So, for example, if I'm feeling pretty certain that this is a case of PANDAS and we're looking at strep, then I'm going to look at the strep antibodies. If it's something else, if it's a virus, I'll look at the viral antibodies. If it's mold, I'm going to look at a urine mycotoxin test, etc. So it's really my clinical judgment that helps me kind of know, okay, which direction are we going to go here and what labs are we going to do? I really like to look at labs around inflammation. So, we might look at, for example, a C-reactive protein to see what sort of systemic inflammation we're looking at. And then immune system numbers. So, different immunoglobulin levels for some kids is important. So it's critical that we find and treat the right pathogen in the right order. Sometimes kids come up with multiple pathogens. So we'll see a kid with high strep levels and high Epstein-Barr, for example, or high strep and high mycotoxins. And so we have to know what we're dealing with. And so that's why, when I have a new suspected PANS or PANDAS case, I really try, to do lots of labs in the beginning so that I know that I have all the data and then I can prioritize from there. So when a child is diagnosed with PANS or PANDAS due to an infectious trigger, so if it's strep, if it's a viral component, if it's mycoplasma, everyone in the family needs to be tested. It's especially pertinent for strep cases because if other people in the family have strep and they don't know it, they're carriers, for example, we're just going to keep passing that around and the child's going to have limited progress. All right, so let's talk about interventions. So traditional treatments for a bacterial pathogen would be antibiotics. And what research tells us is that prompt treatment with antibiotics got rid of OCD symptoms in 8 of 12 kids with pandas. So antibiotics, I think when used responsibly, can be amazing. And sometimes kids with PANS and PANDAS, depending on what their trigger is, sometimes antibiotics are the right way to go. Steroids can be really helpful to reduce inflammation. Other anti-inflammatories can be really helpful as well. Research in some areas advocates what they call the tincture of time. So a waited out kind of situation. I'm never in favor of waited out, especially when we're dealing with, kids with acute onset like this. So many kids are just very, very sick, and waiting it out is not going to help. So I'm never a fan of tincture of time. Sometimes using something like IVIG or plasmapheresis is the right way to go. So this is basically kind of a way to reset the immune system using a specific blood product. For some kids, it's fantastic, best thing they ever did. For other kids, not always is it the best thing. Sometimes getting tonsils and adenoids out is the right thing to do when especially the strep situation is chronic. And then depending on what other pathogens or toxins are going on, there are medications available for that. Holistic interventions. So this is really sort of my area of expertise. So using natural anti-inflammatories, natural antihistamines will cool that encephalitis, that whole brain on fire sort of situation, and it will calm down the child's immune system overreaction. I really, really rely on homeopathy. Again, it varies depending on the child and the trigger. Different formats are available, which is really nice. I tend to use homeopathic series kits, which are small amounts of liquid remedies that you give in a certain order. And what I find is when we use something like homeopathy, it really helps stabilize the situation in a long-term perspective. And so instead of treating the right now problem, we're treating the right now problem and the long-term problem and looking for a stable immune response long-term. There are lots of herbs that are really helpful. Many herbs act as a natural antibiotic. Many herbs work as a natural anti-inflammatory, antiviral. So herbs are really, really helpful. And then, of course, we have to address what made them vulnerable. So if they have nutrient deficiencies, if they have mitochondrial dysfunction, we've got to get in and fix that. And that has to be one of the first things we do. Whatever sort of dysregulation is happening, whether it's the nervous system, the immune system, the digestive system, we've got to straighten that out. Otherwise, we're really just sort of treading water, not making a lot of progress. All right, so what should you expect from intervention? I've seen lots of kids, when we hit the right intervention, their improvement is fast. Generally, though, it takes some time, right? It took time to get here. It's going to take us time to get them out of the situation. We have to calm the inflammation. We've got to stabilize the immune system. We've got to get rid of whatever pathogens are causing this problem. But of course, patients who get interventions sooner than later tend to have better outcomes, right? And flares are probable. So remember, this is a relapsing remitting course. So that's really hard for a lot of families because it sort of incites this almost PTSD sort of situation where, he's finally getting better. And then all of a sudden he crashes again. And so part of my approach is to help families understand that, the getting better and the getting worse is inherent to this, but to be prepared for that and to have some remedies or some approaches waiting in their back pocket for, that Saturday night, 2 a.m. when, child can't sleep and, they're inflamed and they're experiencing some behaviors, right? Having some strategies that you can implement on nights like that really tend to help families a lot. So there's some controversy around PANS and PANDAS. And if you are a parent of a child with this, you've already discovered that there are lots of doctors who don't believe that PANDAS is a real thing, right? So even though there's stacks of research out there, lots of literature around PANS PANDAS, basal ganglia encephalitis, whatever you want to call it. There are docs who will just say, oh, I don't believe in that. That's not a real thing. And so it's just really difficult for families to find a practitioner who is willing to help, who is willing to learn about it, who knows about it. And so sometimes then we also often will have practitioners who follow a really strict PANS PANDAS model. So if, for example, their onset wasn't acute or wasn't acute enough, then they automatically dismiss that as a possibility. And, you know, I'll just tell you, you can't be too strict. You've got to really look at the whole picture, look deep into the history. And if it quacks like a duck and it walks like a duck, right? It's a duck. So, so this is really frustrating to me because, you know, I see kids with PANS and PANDAS from all over. And many times these are families who've been to many, many practitioners trying to find help. And so when they're told, oh, it's not a real thing, or I don't know anything about this, you know, it's frustrating for everybody. And so that's one of the reasons that I brought a pediatrician on, so that I could educate her and so she could be a resource for families. So we have an integrative PANS PANDAS clinic here in my practice so that my medical doctor and I can collaborate and come up with the appropriate treatment plan for the kids who come to us. So again, multiple diagnoses in a child. So they have a behavior disorder, ODD, OCD, ASD, anxiety, ADHD, ADD, etc. When they have this long laundry list of diagnoses, this should be a red flag to doctors. They should absolutely have a PANS and PANDAS workup. So if you want more information, PANDAS Network is a really reliable source of information, as is the PANDAS Physician Network. You can also look on my website. We've got some resources for you there as well. And if you need help, if this sounds like your child, if it's something that you're really suspicious of, like I mentioned, we have the integrative PANS and PANDAS clinic. We offer the functional nutrition that addresses their vulnerabilities. We offer holistic care for digestion, sleep, behavioral challenges. We offer a full laboratory workup. And then, of course, we have a holistic doctor and a medical doctor on staff to manage your interventions. So here's our contact information if you don't already have it. We are in Jefferson City, Missouri, but we have many ways to help you. So if you have worries about your child, we are definitely the place to come for any kind of needs around PANS, PANDAS, or other complex issues with kids. So there we have it. So I hope you found that helpful. Any questions? Happy to answer them before I let you get on with your day. If you just want to drop those in the Q&A box, I'm happy to answer whatever questions you have. We see many, many, many kids with PANS and PANDAS. And I'll tell you, it's possible to get better with the right intervention. There's absolutely hope for every kid. There's hope for recovery for every child, whether it's PANS, PANDAS, whether it's autism, whether it's auditory processing disorder or dyslexia or any kind of behavior, language, or socialization problem. There's absolutely hope with the right intervention. So, all right. Looks like we don't have any questions. Oh, wait. Yeah, we do. Hi, Andrea. Do you review labs prior to seeing a patient? So if you've already had labs done on your child, I do love to have those before the appointment so that I can have a look and kind of help dial in on exactly what has been done, what hasn't been done, how long it's been since last labs. So yes, I really do appreciate having those ahead of time. And then of course, depending on what the history and exam tell me, what kind of prior labs have been done and how much time has passed since those were accomplished, I will generally, order additional things depending on what I think is needed. Joanne, hi, I'm so happy you're here. What are some of the natural anti-inflammatories you recommend? So turmeric is a really good one. Any kind of curcumin turmeric blend is fantastic. I really, really like homeopathy for this. There is, I can't think of the brand right now, but there's a remedy called inflammatone, yeah, which is a liquid homeopathic. It's got a variety of remedies. It has aconitis, and it has belladonna and a few different ones. And it's liquid, so it makes it easy for kids, but it's a really, really good anti-inflammatory. Orthomolecular has something called Inflammablocks, which is also very good. But I just find homeopathy is really gentle and effective. I like belladonna is a very good anti-inflammatory. So there are a few out there, and I really when a kid is a patient of mine, I really try to be really specific about choosing the right anti-inflammatories. Sometimes our doctor here, our medical doctor, will recommend something like just ibuprofen or Motrin. That's really good kind of out of the gate, just to knock that inflammation down quickly, and then we can transition away from that to something more herbal or homeopathic. Sheila asks, what are your best treatments for managing flares? And do I have any recommendations for naturally reducing adenoids? Okay, so managing flares, it kind of depends on what the trigger is. So if strep seems to be the main trigger, I really like putting kids on biocidin toothpaste. It's called dentalcidin. There's so much strep in the mouth, and knowing that any sort of dental issue can really be triggering to kids, I like to use the dentalcidin toothpaste because it keeps that under control and seems to prevent flares a lot. I really also like to use a mouth rinse made from herbs. Chinese skullcap is very, very good. We just mix it in water, and kids can swish their mouth with it, or we can make a spray out of it. Flares in general, I think the best way to manage them in the moment is with an anti-inflammatory. So, an over-the-counter anti-inflammatory, an herbal or homeopathic one is probably the best way to kind of get through it until you can get in and see your practitioner. Recommendations for reducing the size of adenoids. So one of the most common causes of large tonsils, large adenoids, is airway issues. So a lot of times we'll see that these are kids who have maybe some nasal congestion, maybe they have some oral restrictions, maybe they have, some other airway issues that are causing them to maybe breathe with their mouth open, breathe through their mouth, or snore at night. Those are things that will definitely increase the size of tonsils and adenoids. Using some sort of natural antihistamine like Dehist sometimes is a really good option for that as well. So anything that's going to sort of calm that immune system upregulation around those particular immune tissues should help. Great questions, guys. So we are taking new patients. If any of you, feel like you need a practitioner, I do offer telehealth. Office visits are better, but if we need telehealth to kind of get us started, we can always do that. So thanks for coming, everybody. I hope you have a great Friday and a lovely holiday season coming up. And I am always available by email. You can see my email address here, drsonia@covenantwellness.net. If you have some brief questions that I can answer for you. If you're interested in scheduling with me, the best way to do that is by emailing my scheduling assistant. Her name is Brittany. So it's Brittany@covenantwellness.net. So thanks for coming, everybody. It was great to see you. I hope it was helpful for you. Next month, I believe it's January. I'll have to look. January 11th, maybe. I'm doing another webinar on the negative effects of low cholesterol. And let me just look for you. It is January 5th. Generally, it is the first Friday of every month that I do a webinar. So next month is about low cholesterol, and February is talking about selective eating and ARFID. So if any of those are interesting to you, and be watching also your email, you will get a link to a replay so you can watch this as many times as you want. So everybody have a great weekend. Thanks for coming, and have a good holiday.